about this disease condition with the help of an animation video, and then we'll go to the answer. Okay, and we are having one muscle which is called as calf muscle. Okay, so this calf muscle actually will act as a second heart, systemic circulation. It is called as embolus. Okay, embolus or emboli. We are actually running courses for this GCC exams. Okay, GCC Nursing Licensure exams in English. Hi all, welcome to Eduooz International Academy. Today we are going to discuss a very important question that is continuously been repeatedly asking for different GCC exams. Okay, so let me first read the question, and next we will discuss in detail about this disease condition with the help of an animation video, and then we'll go to the answer. Okay, so first we'll see the question. So the question states like this: let's say hospitalized patient has a deep vein thrombosis, right? Hospitalized patient is there and he has developed deep vein thrombosis in the left lower extremity. Which of the following interventions should the nurse stop immediately? Okay, so the patient is having or receiving different interventions, as we can see over these all options, and among that interventions actually one intervention that is maybe causing some complications to the patient. Okay, so what our task is to identify that nursing intervention, and we have to stop, or we are not supposed to give that intervention to the patient. Okay, so we'll see the options. Option A states like this: keep the affected leg elevated on a pillow while lying in bed. Option B, use of a sequential compression device on the leg with the clot. Option C, walks to the bathroom with nursing assistance. And option D, applies lotion to the right leg. Okay, so we'll discuss about this condition, that is a deep vein thrombosis, with the help of an animation video. As we can see in this video, actually this is going to, or this will explain about the occurrence of this deep vein thrombosis. Okay, so as we can see, this is actually the veins over the extremities, and we are having one muscle which is called as calf muscle. Okay, so this calf muscle actually will act as a second heart. What it will do, it will actually pump the blood towards the heart, right? So like suppose if the patient is bedridden like this calf muscle will not function effectively, right? So what will happen is the blood clot, okay, blood clot will actually form near the blood vessels, and subsequently that the size of that clot will increases, right? As we can see here, the clot size will increase, and later on what will happen is the clot that has been formed here, that will get dislodged from there, and it will enter the systemic circulation, right? Okay, so the clot that has been dislodged to the systemic circulation, it is called as embolus. Okay, embolus or emboli. So this emboli means what is emboli? Emboli is moving clot. Okay, so it will enter the systemic circulation like this, and it will move on to the heart, and subsequently it will block the pulmonary blood vessels. Okay, so pulmonary blood vessels, and that area will get damaged. Okay, so otherwise again this blood clot, it can go to any small blood vessels, like maybe in the coronary circulation it can go, and it can lead to myocardial infarction. Otherwise it can also obstruct the blood vessels in the cerebral blood vessels, and it can lead to stroke. Okay, so like that actually many complications can occur because of this emboli. So we have seen like how this deep vein thrombosis will occur, and what all complications it can cause if it will enter the systemic circulation. Okay, so we'll explain each options in detail. So we'll discuss first option. Okay, keep the affected leg elevated on a pillow while lying in the bed, right? Okay, so actually what will happen is this deep vein thrombosis, it will develop in patients who are bedridden for prolonged periods of time. Okay, so in that patients actually you can, or you are supposed to elevate the leg over a pillow. Why it has been done? Why it has been done? Why it has been done? It means it will actually help to reduce the edema. Okay, to reduce the occurrence of edema over the lower limbs. We are actually, or we are supposed to elevate the affected limb over a pillow. Okay, so that is actually, that can be done for this patient. Next, just see option C is walks to the bathroom with nursing assistance. Okay, so if you want to mobilize the patient, mobilization is always encouraged, right? Okay, so you are supposed to, or you can help the, or you can assist the patient to walk towards the bathroom with nursing assistance. It can also be done. Next, just see option D, applies lotion to the right leg. See here, actually the patient is having deep vein thrombosis over the left lower extremity. Okay, so you can actually apply emollients or oil or whatever lotion you can apply over the right leg. But if suppose the patient is having deep vein thrombosis over the left leg or left lower extremity, actually you are not supposed to apply anything over that area. Why? Because it can lead to dislodgement of the clot and it will lead to occurrence of embolization. Okay, so here actually what the answer would be? The answer would be option B, that is use of sequential compression device on the leg with the clot. Why you are not supposed to use this sequential compression device over that leg? Actually, what is this sequential compression device or SCD? This SCD is one thing that will actually apply pressure or apply like intermittent pressure over that area. Okay, so suppose if the patient is bedridden for prolonged periods of time and the patient is not having any complications like deep vein thrombosis and all, you are supposed to or you have to actually give this sequential compression device. Why? Because whatever blood that has been accumulated in the lower extremity because of this immobility, that will get that blood will be moved to the systemic circulation, means it will lead to decreased chance of occurrence of blood clot or thrombi. Okay, so if the patient is not having any deep vein thrombosis or any complications, you are supposed to give this sequential compression device to improve the circulation, right? Since here actually the patient is having deep vein thrombosis over the left lower extremity, you are not supposed to use this sequential compression device. If you are using this sequential compression device in a patient who is having deep vein thrombosis, what it will lead to? It will lead to like immobilization of the clot, and it will change into emboli, and it can obstruct any of these blood vessels and will lead to complications in the patient. Okay, so this is what actually I wanted to convey or I wanted to explain regarding this question. It's actually been repeatedly asked for many questions. So we are actually running courses for this GCC exams. Okay, GCC Nursing Licensure exams in English. Okay, so you can join with us and you can win with flying colors. Okay, thank you.